Hello, this is Dr. Janisch. This video is the second day of Xiaflex treatment, Xiaflex day 2, and we're going to be manipulating the finger now and breaking the Dupuytren's cord. The patient presents back in the dressing that was placed the first day of the injection. You can see that this patient's hand has some bruising and swelling from the injection. The small purple dot in the palm of the hand is where the Xiaflex was injected. I'm going to clean the wrist and hand with chlorhexidine. This patient's going to be receiving an ultrasound guided wrist block, which allows me to perform the manipulation under anesthesia. I'll be placing local anesthetic into the wrist around both the median and ulnar nerve using ultrasound guidance. This is done with a sterile ultrasound probe. This is done in the office and the patient is awake for this procedure. Once the ultrasound probe is sterilely draped, we'll begin the injection. You can see the patient's finger is stuck in the flexed position secondary to the Dupuytren's disease. He is unable to straighten his finger. Here I'm surveying the wrist, taking a look at both the ulnar nerve here and then scanning back over to the median nerve. The median nerve is the honeycomb-like structure that is in the center of the screen right now. Using ultrasound guidance, I'll insert the needle under direct visualization, follow that in to the wrist, and inject local anesthetic around the nerve, being very careful not to inject into the nerve. You'll notice that the needle travels below the nerve, filling this space with local anesthetic, again being very careful not to inject the nerve. Now the needle is advanced over the top of the nerve and local anesthetic is infiltrated above as well. At this point you can now see that the median nerve is entirely surrounded with local anesthetic, creating an excellent wrist block in the median nerve distribution. Now I'll do the exact same thing to the ulnar nerve using ultrasound again. This will give numbness to the palmar area of the ring finger, which is actually innervated by both nerves. A small band-aid is placed over the injection site, and we'll give this some time for the local anesthetic to take effect. This can sometimes be a little over 10 minutes. I now check for numbness and make sure that the patient is comfortable prior to performing the manipulation. The patient is comfortable, and I'm showing now how this finger is still flexed secondary to the Dupuytren's cord. This manipulation actually startles the patient. This is because there's an audible popping sound that the patient wasn't expecting. It wasn't that it was painful. I'll straighten the finger all the way out to 0 degrees, and this patient will now be sent to hand therapy where a orthoplast splint will be fit that the patient will wear over the next month. Thanks for watching. Hope you enjoyed the Xiaflex Day 2 manipulation under ultrasound guided wrist block.